I'm here with Dr. Caron Helfner.
Hi.
Hi. We're live. We're at work today at Inspirations for Youth and Families, and yesterday we promised you a 4-part series. So today is our second of our 4-part series to help parents and students or children who are using drugs or struggling with drug abuse. So today we're going to talk about parenting and authority. Yesterday we talked about mental health, so we're going to tie that in today. So what do you say, Caron?
Well, I think a real huge issue is families not knowing what to do, whether it be imposing chores at an early age. If a kid says, no, I'm not making my bed, I'm not doing it, but here's your cell phone. So it's when to have some boundaries there. Not to give so many choices. If a parent wants to take their control back, that's a big piece that needs to be worked on. And just so you know, here when I do family therapy, the parents are very much our client. They want to learn how to reconnect, but to take control back.
I agree. So I believe in parenting with love and authority. Parents are responsible. And I think that's something that we need to start talking to our children about. They are legally responsible for their children's behavior. And if you see some of the situations coming out in the news these days, you know, when children are acting out or they're found in legal situations that parents knew about or can be held accountable for, then the parents are held accountable. So if a child steals something or damages someone's property, the parents are responsible for those damages. So to that end, I think that we as parents, we as educators and therapists are obligated to talk about this issue. So I'm a big advocate of behavior contracts. So I think they're very helpful because it's difficult to remember what you said when you said it, and believe me, your children will remember better than you do.
Right.
So, and then they'll turn it sometimes in their favor. So I think setting boundaries, expectations that are relevant for your family, and then identifying it on a behavior contract helps. So if a child has certain chores that they have to do, or they have to be held accountable for cleaning their bedroom and maintaining maybe their bathroom, even if you have someone that helps you clean the room, I encourage you, or clean your home, I encourage you to have your children be responsible for their area. If you're giving your child a cell phone or any other devices, laptops, iPads, anything like that, I think that they should work for it because it helps them to understand the amount of money it costs you as a parent to provide those items and how that accountability becomes part of a team building effort and a family effort to have one voice and one family, and really I think it ties into their moral compass.
It
right?
does. A recommendation would be you don't start at 15 years old.
Yes.
You start at the very beginning. You start putting consequences, what your expectations are as a parent.
And rewards?
And rewards. Right. You know, if you're a working parent and you're not home until a certain time, what is your expectations? Getting your homework done, checking it. If it's not done, what's the reason? But keep on it. If you don't stay consistent, they lose the respect. They know you're not going to follow through. So it's a give and take, but you are always in control. And we talk to parents about that all the time, and the parent feels that the kid is in control at many times. So it can be turned around, but start at an early age, or get the help that you need. Get into some family work. Because you can regain the control, and like Caron said with the rewards. Don't say if you wash the dishes, I'll make sure that you're friends and all get to go to the movies. But that's part of the home. That's part of what we all do as a team. But that's my opinion. That's how I kind of raised my kids. Everybody is different. Everyone has different rules. But you have to be in control.
So parenting with love and authority, that's the topic today. If your child may have a mental health issue such as depression or any other challenges and disabilities, identify it. And then regardless if it's been identified or it's been eliminated, still have those basic boundaries that you set for your child or your children, rules of the home. They can be reinforced with a behavior contract. The reason why this is so important is what Caron and I see is that many children who come into a facility like Inspirations who are using drugs are typically out of control, and the parents feel as if they have no control. And culturally, we're kind of pushing against an avalanche of no control. We have children who are driving at 16. They want not just a car, they want BMWs and they want Mercedes, and they push the parents and they play the emotional card that they should have what they think everyone else has, or what they think our culture is saying they should have. Even in kindergarten, some schools are asking for iPads and laptops. Children are expecting cell phones. Now, I thought 9 was young, but now it's 6 and 7.
Yeah.
They're expecting cell phones. So we're not saying you can't give that if that's your choice. We are encouraging parents to set some limits and set some earning factor in there. This is what you earn, and in order to keep this, these are the expectations. And if you fall short, we will have to take back this privilege until you can make up whatever it is you fell short on. What that does is set the stage for those teenage years, right?
Yes.
The preteens, when they think
yes.
they're going to try to get high, or they're going to get high, or they're going to do pills or take pills or do whatever everyone else is doing that they think is what they can get away with,
Yeah.
what their parents, right?
Very much so.
And so when you set the stage, they already know, wait a second, what's at risk? You know, what am I going to lose? What are my privileges? Is my car going to be taken away for 30 days?
Right.
So those are some real consequences that might help, not always. This isn't a guarantee. What about marijuana, medical marijuana? It's killing us. It's really a big issue.
It's a huge issue, and aside from just the medical marijuana in general, whatever my position. Okay.
So medical marijuana, yes, it's a huge issue. And one, like Caron said, because some parents are smoking. So we're not here to take a position on yes or no to medical marijuana or marijuana in general. That's not our place. But we are here to say that we have to start that conversation, because culturally speaking, societally speaking, we are informing our children or giving them the message that marijuana is acceptable. They don't understand that what they think is acceptable is really impeding growth and their ability to really perform as an individual, because they're not thinking about that adolescent brain that isn't formed, and that THC will attach itself to the end of their receptors, and that will interfere with their ability to think, to rationalize, to make better judgment or have better judgment. So that's a topic that we encourage parents to discuss and set out some very clear boundaries. And as far as we are concerned, right, as clinicians, it's okay to say, as a parent, parents So again, because children don't enjoy the same privileges as adults, and again, this is not a topic to debate alcohol or marijuana or drugs. Again, though, we have to bring up the topic. And how are you going to handle it when your child puts it in your face, so to speak?
Well, as we all know, and maybe even for myself, and again, I have 3 adult children now, but a lot of parents will say, well, as long as they're doing it in my house, it's okay. Whether it's in the basement having some beers or some friends, they're all smoking a joint. Once you've allowed that boundary to be crossed, you're losing the control. You're giving them carte blanche to be able to get high, to be able to get drunk, but because it's in your home. Mind you, it's illegal. Mind 100%. You that if it's reported in the school, it's not just the kid. You become just as much responsible for that issue. We see it all the time. Again, I believe that things should start at a very early age. It's not send them to school and have the teacher fix it. It's we need to be the role models and be confident in ourselves as parents. And it doesn't matter what you do for a living. Right. You are a parent, and you want the respect. You want your children to be a product to go into society. It's a reflection of you. So at the facility, we really push that. It isn't, a castle they're coming to. They are going to appreciate what they have at home and no longer take advantage.
I agree.
So parents have been very happy when they've come to treatment here. The parents learn to have confidence in themselves again.
And to parent with authority.
And to parent with authority. Yeah. Correct. So I'm really proud of that.
And so am I. So that's what we do. We help the kids, we help the parents, and we're encouraging everyone out there to reach out to us if you have some questions about how to have authority in your home, whether you're just starting authority or whether you need to regain it. We're here. We'll answer your questions. And again, thanks for being here. And we have 2 more videos to go. So we'll see you soon.
Have a great day.
Bye.
Bye.